The coronavirus is having a serious impact on the UK healthcare system, and Prime Minister Boris Johnson wants to take countermeasures as soon as possible. But what might they look like? Well, the Omikron wave continues to hit England hard, and the first consequences must now be drawn. The high numbers of infections are increasingly leading to staff shortages and supply bottlenecks in hospitals and other areas. Greater Manchester administration announced it would postpone non-urgent operations in hospitals in the region for the time being. In the announcement from Wednesday, it was said that cancer, heart and vascular diseases and transplants are not affected though. The high and rising level of staff shortage is the main reason for this decision. Around 15% of the employees in the region's hospitals are currently suffering from COVID-19 or are in quarantine. Hospital operators have also triggered the disaster situation in other parts of the country in the past few days. Well, the government in London reportedly wanted to announce a change to the testing rules on Wednesday. It was only what I got. In the future, a PCR test to confirm an infection should no longer be necessary after a positive antigen test in order to trigger mandatory isolation. This is intended to shorten the isolation time and reduce the high demand for PCR tests. UK Prime Minister Boris Johnson has since admitted that the NHS Health Service is under considerable pressure, as he puts it. Nevertheless, he refused to tighten the corona measures. He justifies this with the fact that the high number of infections has not yet led to similarly high numbers of hospital admissions, although they are rising and rising. More than 218,000 new infections were reported in the UK on Tuesday. This value contains some late registrations from the past few days because of the holidays. And I'll see you in my next video. Bis gleich.